Hi, everyone. Welcome back. Today, we're joined by Dr. Eddie Stenehjem to give our weekly COVID-19 update for the state of Utah. As always, we're going to go over case trends first and kind of what's been happening since the last time we met. Dr. Stenehjem, thanks for joining us. Appreciate it.
Thanks, Amanda. I must say that mannequin behind you looks...
It's a new addition to my lives. Hopefully people like it. So the total case counts for the state of Utah is 225,946. Yesterday's daily case count was 3,401, which makes our 7-day rolling positive average 26.2%. Our total deaths in the state of Utah are 1,016, and yesterday's were 21. And as far as hospitalizations go, we have had a total of 9,187, with yesterday's daily hospitalizations at 554. I want to start talking about deaths. There was a viral meme or list going around about the 7 deadliest days in U.S. history. And on that list, there were 4 days from the COVID-19 pandemic. Wednesday's total deaths throughout the U.S. were 3,124, which now tops 9/11's deaths and just sits under Galveston's deaths for the U.S. What does that mean for us? How are we doing? What are we seeing for as far as the epidemiology of this pandemic?
Yeah, you're right. I mean, this was the headline this morning, right? In the Trib, 1,000 deaths. We've hit that pretty sobering mark here for Utah. And Utah is one of the best states in terms of mortality rates in terms of COVID-19 for a variety of reasons. So it is really sobering when you put it into that context. When you look at the top 10 days of deaths in the U.S. and the past couple of weeks are 7 of them. I mean, that's pretty sobering. So the local epidemiology right now is a bit challenging to interpret. So we're going to try to walk through it as much as we can. What we've seen really now for the past 2 weeks is we saw kind of an initial decline in cases, an uptick after Thanksgiving, and then kind of now a stabilization of the cases. We are now 2 weeks out from the Thanksgiving holiday. And so when you think about incubation period of the virus being 5 to 7 days, people need a few days of symptoms, 2, 3, 4 days of symptoms to realize they need to go get tested. Then they get tested, and if they wait 24 to 48 hours for a positive test, we should be seeing our cases now being reflective of the holiday, adding up all of those things together. Unfortunately, we haven't seen a huge spike. Okay, so that's amazing. And what that tells us is that thousands of people, thousands of families across the state of Utah heeded public health advice and changed their Thanksgiving Day plans. We got vaccines on the line, sorry. And that is a testament to our community, saying we're going to put the health of our communities first, and we're going to celebrate Thanksgiving, get together with our families in an alternative method. And so that's encouraging, but we have to also say, well, what's happened to testing? And when you look at testing, our numbers for testing really went up right before the Thanksgiving holiday, and then they came down and now have been kind of stable at a lower level of tests as comparison to pre-holiday. And so decreasing in testing is also going to decrease our number of positives. And so that may be a reason why we're not seeing a huge influx. And you have to look at your test positivity percentage. And so when you decrease the number of tests, you're going to probably increase your test positivity, which is what we've seen. We've seen our test positivity shoot up. What that tells me is that, well, there's one thing, the fact that a number of testing centers were closed over Thanksgiving. So that's one aspect of it. We shouldn't be seeing that now. What it's telling me is that test-seeking behavior is changing a bit. And what we're definitely seeing are those people that truly have symptoms and maybe worse disease going to get tested and are positive. And so I think what we can say is that we haven't seen a huge spike post-Thanksgiving, but we still remain cautiously kind of optimistic about that. One of the markers that's really helpful is hospitalization numbers for COVID-19, because that's kind of independent of testing. People need hospitalization, they're coming to the hospital and getting tested. And so that's a good marker to follow because it takes away the reliance on people's behavior to seek out testing. So when we look at hospital numbers in terms of when they are going to occur, from a Thanksgiving Day holiday, hospitalizations are really going to be starting now. When you think about the incubation period, you get positive, and then usually hospitalizations occur 7 to 10 days after a positive test. And so following our hospitalization trends for the next week is really going to be reflective of the Thanksgiving Day holiday. And that's going to be probably a better test of how we did over the holiday compared to just reliance on test case counts. I can tell you that we've had some pretty tragic stories about Thanksgiving Day holiday leading to severe cases. And we're already seeing some hospitalizations that have stemmed from Thanksgiving. And, it's exactly the story that we warn people about. It's grandma and grandpa getting hospitalized after having a Thanksgiving Day gathering where somebody came to the gathering, felt fine, the next day developed symptoms, then got tested positive, and now almost the entire family is sick, but grandma and grandpa are in the hospital. And so we're seeing that in our hospitals right now, and that's really unfortunate and sad. Our hospital numbers are still really high. Our numbers reflect very similar to the state numbers, and what you can see is that we've had a plateau of hospitalizations. They aren't rising like they were in November and really all of November. They've really kind of plateaued. And so that's encouraging. And what we hope is that we don't see those start to go up due to the Thanksgiving Day holiday. Our ICU referral ICU capacity is still 94%. I mean, we're still very, very full, with COVID making up about 40% of those patients. And so really, really full. And then after hospitalizations comes deaths. And so that's why we're seeing all of these deaths now, is because these are reflective of the surge that we had, 3-4 weeks ago. So I anticipate our death count, unfortunately, to continue to go up. And that's what we're seeing all across the US as well.
I was going to mention the referral rate. I just pulled up the coronavirus Utah website, but you just mentioned it. It's 93.8%, 435 out of 464 beds are currently being used. And I think it's interesting to note the 40% of COVID patients. Yes, our ICUs are not completely full of COVID patients, but it doesn't matter what they're full of. If they're full, you can't get access to that care, which I think is super important to remember. So thank you for bringing that point up. I want to address something really quickly that I've seen just kind of floating out there about this exchange of money for getting a positive test. So I'm going to give you a hypothetical. For example, if I have symptoms, decide I need to go get tested, I go get tested at one of our facilities, I wait until I get my results back, it's positive. There's this assumption that all of a sudden the hospital gets some sort of kickback for my positive test if I don't need any sort of hospitalization. Is that true? Are the hospitals getting a kickback if I never step a foot into your hospital?
No, I've never heard of that. We are offering a service to the community in terms of testing. COVID-19 testing is free to the public. And we don't get any type of reimbursement, regardless if your test is positive or negative. It's just a service that we provide as a testing service, and it's either positive or negative, and it ends there. There is no financial compensation that we as an organization get from the federal or state government for positive tests.
Yeah, there's this assumption too that we gain something from inflating the numbers of tests, hospitalizations, and deaths, and that's really not the case. I don't think we would gain anything from that, and it also doesn't help the data in years to come if we inflate numbers now, because we're not actually able to learn about what actually happened during this pandemic. So if you're looking at information on the internet, please check your resources and make sure they're coming from a medically sound, peer-reviewed source that you can actually credit back to something. I think that's important. So I just wanted to bring that point up. Let's switch to vaccines. Vaccines are very relevant right now. Lots of things are happening in the last couple of weeks. Pfizer's results were just published in the New England Journal of Medicine, and they were also reviewed by the Independent Advisory Board. Will you give an update on what they reviewed, what they saw, and what that means for us?
Yeah, this is, why I said I have vaccines on my mind is this is what we've been talking about nonstop for the past 48 hours. Huge movement in vaccine in the past 24 hours. And so really 48. So the Independent Advisory Board to the FDA called VRBPAC met yesterday. Their role is to review the application that Pfizer submitted to the FDA for emergency use authorization and give an independent recommendation to the FDA whether or not the FDA should support an EUA, or emergency use authorization. So on this board of 22 people, it's essentially all the national leaders in vaccinology and statisticians. I mean, this is such an incredible group of people. They poured over the data that Pfizer submitted to the FDA, which is a mountain of data. And I would say that that data is all publicly available. And so if you go online and search FDA Pfizer application, you will find a link to Pfizer's application for the EUA. It's about a 170-page document. FDA also has another document that's about 60 pages that presents all the data for anybody to look at. So this committee reviews that data and then makes a recommendation, and they made a recommendation to approve the vaccine. And this was done yesterday afternoon, and you can watch the proceedings online. And so they made a recommendation to approve the vaccine for people up age 16 and up. And what we are now able to do is really kind of take a look under the hood of the data of this phase 3 trial that Pfizer ran, and really get in and dig into the data in terms of efficacy and also safety. You can look at the different subgroups stratified by age and race and ethnicity and gender, and really look at what are the outcomes and what are the safety concerns. And I can tell you, this is such good news. And this is what we need right now for our community is good news. And we'll consider this an early Christmas or Hanukkah present, whatever you want to call it. But being able to look at this vaccine, and aside from maybe MMR and Shingrix, we've never seen better vaccine data. It's shown to be 95% efficacious and have essentially minimal, if any, serious safety adverse event concerns. And so we're really excited about this. And the data looks very, very good, not only as the whole study, but also when you break it down by age group. And so when you look at ages less than 55 and ages above 55, it looks to be equally efficacious in both groups at about 95%. And if you look at people with comorbidities and no comorbidities, it looks about the same. If you look at people that are obese and not obese, it looks about the same, all at this rate of about 95% efficacious. So it's really exciting news. You have to couple that with, well, what did the safety event profile look like? They didn't find any serious safety events, meaning essentially death or neurologic complications at all within the first 2 months of the vaccine study. And keep in mind that vaccine-related adverse events occurs within the first 2 months. And so this is the reason that the FDA said you have to have 2 months worth of safety data, is that that's when this happens. And we haven't seen anything in this trial so far. The vaccine is what we call reactogenic, meaning that after you get the vaccine, particularly the day after, you do have symptoms of essentially sometimes low-grade fever, chills, and arm pain. And that's common. And we have to be okay with that. And we have to educate people to that and know that that is an expected side effect, and really showing the fact that your immune system is working and identifying this protein and making an immune response to it. And so really good news in terms of all the data that we were able to look at.
A couple of questions for you. The first, Someone asked if you are going to be taking the vaccine. You don't have to answer that if you don't want to. You could just say instead, do you recommend the vaccine for the general public?
Absolutely, 100%. I will be first in line to get this vaccine when it's available to me. And I'm going to be very public about it. I mean, this is a vaccine that I'm going to take. It's also a vaccine that my wife is going to take. We're both frontline caregivers taking care of both COVID and non-COVID patients. And yeah, we absolutely will take this vaccine. And I'm going to tell you why. It's because I've looked at the data, I've talked to the experts, and this is, a safe and effective vaccine. And I want to protect myself.
Next question for you is around the rollout and how that's going to look for the state of Utah. I know that the governor yesterday threw in the use of teachers into this phase 1. Will you just kind of explain to the public what the phases are going to be for the state and how that'll look to get to the general public eventually?
Yep. So keep in mind that, Utah is beholden to Operation Warp Speed in terms of how much vaccine we get. And so we can put in, our requests, and it's actually into kind of an algorithm at Operation Warp Speed in terms of our population. And so we get our vaccine allocation to the state, to the state health department, and then the state health department then allocates it out to the different COVID hospitals where majority of COVID patients are being cared for. And so phase 1 of that is hopefully happening next week. And so we expect that the FDA is going to grant an EUA to this vaccine likely this weekend. And then CDC is also going to give recommendations on this vaccine likely this weekend. And within 24 hours of that EUA being granted by the FDA, vaccine will start shipping. And then we should have vaccine, as long as this goes as we expect, we should have vaccine in Utah, I'm hoping in Monday or Tuesday. And then that will be then allocated out to the COVID hubs that has been set up by the Utah Department of Health. Then once they get sent to the COVID hubs, then we can start vaccinating healthcare workers almost immediately. So we hope that we'll be vaccinating healthcare workers this time next week. So maybe Thursday, Friday of next week. The first phase of this is vaccinating frontline healthcare workers and also residents of long-term care facilities, and also the people that staff the long-term care facilities. That's really the phase 1 has been directed by the CDC and the Advisory Council of Immunization Practices and what the Utah Department of Health has agreed upon. After that, what happens are these kind of what we call essential workers. And so essential workers would be teachers, for example, and Governor Herbert today in the paper said that is going to be the next group is teachers, to make sure that we can get our kids back safely into school and our teachers can remain healthy. But it'll be teachers, think about grocery store workers, think about first responders. Those are kind of the people in that next group. The following group will start vaccinating large amounts of patients. So patients that are at high risk for complications if they were to get infected. So those that have serious underlying medical comorbidities, think about like a cancer patient, kidney disease patient, heart disease patient, and then people over the age of 65. Okay, so that's kind of the next group. How fast we go through this is dependent on a number of different things. One, probably the biggest thing, is the supply we receive from the federal government. Okay, so we obviously can't vaccinate people if we don't have the vaccine. That vaccine comes from the federal government and then it's allocated at the state level. And so how quick we can do this is really going to be dependent on how much vaccine we get from Operation Warp Speed. Keep in mind that these are 2 vaccine doses for the series. So Pfizer is 21 days apart. And so you have to ensure that, if you vaccinate a group, you have to have enough vaccine to revaccinate them at 21 days. So that's going to be dependent on our drug supply. It's also going to be dependent on additional FDA EUAs for other vaccines. So keep in mind the Moderna vaccine, which has data that looks very similar to the Pfizer vaccine. They're going to be meeting next week, this advisory council, the same one that just met yesterday, is going to be meeting next week to make a recommendation about Moderna, which then could have an EUA within a couple days after that. And so then we will also have the Moderna vaccine, which is going to add to the volume of vaccines we'll be receiving in Utah. So we may be able to speed this up even faster if we get more and more vaccines approved by the FDA. So really complex and a lot of moving parts. But we really hope to be vaccinating high-risk patients in addition to essential workers, early in January, if everything goes smoothly.
2 questions for you. People wanted to know about pediatric trials. I know you mentioned that the EUA is for 16 plus. Are there trials ongoing right now for under 16?
Yeah, so there was a lot of discussion apparently at the VRPAC meeting yesterday about the 16 and 17-year-olds, and they did vote 17-4 to approve the vaccine for the EUA, which goes down to age 16. The 4 dissenters in that vote was really focused on the 16 and 17-year-olds because we don't have a ton of data. But it looks like the FDA will grant an EUA for the 16 and 17-year-olds. The Pfizer study has opened up another arm to vaccinate people down to age 12. And so we don't have any data on that yet. But kind of reading the tea leaves, what I would imagine is that this EUA is going to cover 16 to 17. We'll have more data coming out about the 12, 13, 14, 15-year-olds, in addition to more data on 16 and 17, which may then get itself an EUA later on. But right now, the EUA is not going to cover those less than 16.
What about pregnant women? We've seen a lot in the media around the fact that this vaccine is not, the trials were not involving pregnant women or women who were looking to get pregnant. Can we talk about the overall use of pregnant women in clinical trials for vaccine in general too, and kind of what we typically do for them?
Yeah, and I'm not a vaccine trialist, but pregnant women are typically not in the first round of vaccine trials. They're a special population, and typically they kind of fall out of those first trials. And in fact, in the vaccine and Moderna trial, pregnancy was an exclusion criteria. So they did not include pregnant women in their trials, knowing that they're going to have separate safety analyses for pregnant women. However, there were 24 people in the trial that were found to be pregnant after getting the first dose. And so they did report on that data and showed that there was no serious safety events in the group that received the vaccine. Because keep in mind, there's 24 people in the trial that were pregnant, but half of them got placebo. So now you're only down to 12 people that received the vaccine and were pregnant. And so we don't have a ton of data to go on. That said, this vaccine is not a live virus. There's absolutely no viral replication with this vaccine. And so scientifically, this should be a safe vaccine in pregnancy, but we just don't have the data on this. And so I suspect that the vaccine could be taken if you're pregnant. And so, I'm just thinking about what about if you had a frontline pregnant healthcare worker? That person, in discussion with their OBGYN doc, would qualify to receive the vaccine. We don't want to not give them the vaccine just because they're pregnant. But we're not going to have a strong recommendation currently. It looks like over the weekend, there will be some meetings about this with maternal fetal medicine groups at the national level. So we may have some guidance on that. But what I would say is, by all means, talk to your OBGYN doc if you're pregnant and you fit into one of these categories where you could receive the vaccine. And it's really kind of weighing what is the risk to you in terms of being exposed to somebody who's infected with COVID-19, and what are the potential risks, which are likely very small, of receiving the vaccine. And so don't have a great answer to that, except talk to your OB and talk about the risk-benefit profile. And we're hoping that we'll get more information by early next week before we start doing any vaccinations.
Last question for you. This is around after you get the vaccine, or the lack of vaccine for people under the age of 16. this is a two-part question. So the first one is, I get the vaccine. Why do I still need to wear a mask?
Yeah,
We'll answer that one first.
we'll get that. So keep in mind what these trials studied was a symptomatic endpoint. And so in order to do the study, they said, we want to know about people that got vaccine or got placebo and then developed symptomatic COVID-19, whether it be a cough, fevers, chills, whether it be mild symptoms or severe symptoms. That was the endpoint. Okay? And so what we know is that in this trial, the vaccine did a very good job of essentially, I wouldn't say eliminating, but reducing the chance of getting symptomatic COVID-19. What this trial didn't do was assess whether or not people got infected and whether they were asymptomatically infected. And so that's a different study design, right? You have to go and do nasal swabs of people after they get the vaccine to see if they get asymptomatically infected. And that is a much harder trial to do, much more expensive, and not something you can do in the time frame we needed to get this trial out. And so what we don't know is whether or not the vaccine prevents full sterilizing immunity where you can't get infected. And so what very well could be the case is that this vaccine prevents symptomatic infection, but you could still have virus in your nasal cavity and still potentially transmit virus to those people that are, at high risk for bad complications from COVID-19. And because of that, we have to continue doing the public health measures that we know work, the masking, the hand hygiene, the social distancing, because we just don't know if the vaccine prevents transmission altogether or whether it just prevents symptomatic disease. And so we know that we're going to be resting on those public health measures for a good bit coming into kind of through the winter and into spring, and then really be working with the state health department to say, at what point are our numbers so low that we can kind of pull back on some of those measures, whether it be masking, social distancing, gathering sizes, that type of stuff. And so for now, absolutely, we need to continue those measures. And we can't let this good news of a vaccine allow it to change our behaviors that have prevented a huge surge after Thanksgiving. I kind of think of this vaccine as a light at the end of a pretty long tunnel still. That tunnel may be 3-4 months kind of long, but there's a light. And we haven't had a light at the end of that tunnel until now. And so that's the way I think of this, is that we have kind of an idea of a way out. We have a way to protect our community and the people that need it most with this vaccine. And it now is going to take us a bit to be able to vaccinate all those 150 million people in the US that fit into those categories. And so it's really exciting, and it's kind of the hope and excitement we need right now, especially in healthcare, as we're still drowning in COVID-19 patients.
You mentioned the public health portion of this, and I think we can look to other countries. There's an article published recently about how other countries have almost forgotten that they're in a pandemic because of how well their public safety measures have worked. And a lot of them are island countries that have a lot less ability for spread. But I think it's a silver lining in that little light to look to other countries on how they're performing. So the vaccine just adds that additional factor. So that's good news. My other question around the precautions is, someone specifically wanted to know, so they're not vaccinating children under 16. Do I still need to keep my children apart from other kids, social distance? You kind of mentioned this, but say mom gets vaccinated, but mom and dad get vaccinated, but your 15-year-old child doesn't. What are you supposed to do in that kind of a bubble?
Yeah, it's, it is hard because you have to start thinking about kind of next generate, just more complex transmission patterns. Take my family, for example. My wife and I get vaccinated. We have 2 small kids. Our kids aren't really seeing other people right now, except our nanny. And our nanny's not vaccinated. And she's married and has exposures. And so, you have to start thinking about those downstream consequences of, yeah, mom and dad are potentially vaccinated, but takes their kids to see other people. And now the kids are exposed, maybe asymptomatically infected, but who do those kids see, and what are their vaccination status? So it gets really complicated, but the answer is you still have to, follow those public health guidance right now in terms of, who you're contacting with, and what are the size of those circles. And you can't let vaccination status really, take us out of those good, sound public health measures.
I think that's a good summary of it. Regardless of whether you get the vaccine or not, those public health measures still need to be something that you're following. You still shouldn't be hanging out with 20 friends or even family who don't live with you, etc. So that's something to consider. Is there anything else you want to mention around the vaccine, or anything we've learned in the last week since the last time we spoke?
No, I mean, I think the biggest thing is that this is a safe and effective vaccine, and the way we get out of the pandemic here in Utah is to vaccinate people. And so there's going to be a strong push to get vaccination in arms ASAP. And there's going to be a lot, I'm certain of it, there's going to be a lot of opinions online. There's going to be a lot of people commenting about the vaccine. Get your information from a trusted source. Know that there is no live virus in this vaccine. Know that this vaccine isn't made from DNA taken from other people. Know that this doesn't have a microchip in it that tracks you. Know that this is a safe, effective vaccine. And just really understand the source of information that you're getting, and go to trusted sources, and go look at the primary data yourself. Go online, look up the FDA, application. People are smart. They can Google words that they don't know, but it's there for everybody to see. Go read it. Read the primary literature about this vaccine, because it's there and it's available for you. Don't rely on comments in social media to get your information about this vaccine. Go to the source and educate yourself. And it's a safe vaccine, and this is the way out. This is the way to get our economies back. This is the way we can get some sanity back to us and get us back and socially engaged. And quite frankly, I just can't wait. It's been, it'll be a year coming up in March, and it's a long time.
It was a very long time. It feels like the longest and shortest year ever. And then that's great advice. And Eddie, maybe you can send me the link for that specific study, and I can post it later just so that people have a direct link to that source. I think that'd be helpful, because I was just trying to Google it, and a lot of news articles pop up first. So maybe we can point people to the correct direction of what they can look at. But thank you for all the valuable information. I really appreciate it. And if you guys have any questions about COVID-19, specifically around testing, you can go to intermountain.com/COVID testing. You can find out if you qualify for testing and set up an appointment arrival time to get tested at one of our facilities. We also still have our emotional health relief hotline available 7 days a week from 10 a.m. to 10 p.m. The phone number for that is 833-442-2211. The holidays are coming up. Get the support you need during this time. Eddie, again, thank you so much. And I'll post this link when we're done, and we'll talk to you next week.
Sounds good.